Yes. So most of my patients want to have small procedures, and therefore all of them works with threads, with minimal scars. So, and we have developed endoscopic mid-face lifting, what I will show you now. So the facial aging is equal with the mid-face aging, said Giovanni Botti from Italy, and according to his meaning, it is the most important trend in the 21st century. The aging begins by everyone in the mid-face, characterized by hollow eyes, tired look, visible bony structures in the orbita and nasojugal nasolabial folds. The reasons of the early mid-face ptosis are that the lateral face is anchored onto the zygomatic arch, therefore it is stable. Moreover, the lateral face is thin and has a stable internal fascia, the SMAS. The mid-face, against, contains a heavy fat pad and its mass is thinner. Therefore, the mid-face weakens easily by the gravitational forces. Gathering of the ptotic soft tissues of the mid-face causes then jowling between the chin and the lateral mandibula. The goal of the TEM is to reconstruct only the sunken areas and not the healthy areas. Our patients understand well and show us the proper vector of pulling of the soft tissues. They show the right vector for lifting of the mid-face and no lateral pulling for the lateral face. Then the lateral face is stable. It is not sunken. In fact, the middle parts of the face are always ptotic. Mostly, they should be lifted and not the lateral face, especially by young patients. We can reach the mid-face easily from a pretrial or temporal access. However, the pretrial access, such as maxlift, causes visible scars. Using an endoscopic aid, we can use a small hidden temporal incision for the mid-face, which don't cause a visible scar. So I'll show you what we do. The TEM lifting, our goal is to lift, first of all, the malar fat pad, which causes the sagging of the mid-face. Of course, the soothe is lifted also, and the skin flap we perform, we lift also. We plicate the SMAS as by a normal facelift, but an endoscopic way. We are mobilizing the structures, reposition it, and anchor onto the malar bone. The anchoring has two different ways. First, an indirect way with the suspension sutures, so long sutures. I don't like them because they haven't longevity. I prefer the short sutures, the direct anchorage of the SMAS onto the malar bone or onto the fascias. So direct anchorage preferred. Now I'll show you what we do per video. I will show you if the technique will also. Sorry. Now.
The temporal endoscopic mid-facelift was developed by Dr. Haffner, a cosmetic surgeon in Cologne, Germany. The TEM is a new scar-saving procedure for the rejuvenation of the face. Even young patients have hollow eyes, deep nasojugal and nasolabial folds. Early aging leads to ptosis and flattening of soft tissues of the face, losing its dynamics. Baggy eyes, nasojugal and nasolabial folds develop, making the patient look tired at all times. The main goal of the TEM is a lifting of the malar fat pad without any facial scars. For this kind of scarless lift, there is only a small temporal incision necessary. It is very important to have all wishes of the patient, the subject of the lifting, and to do the proper markings before this procedure. The superficial temporal fascia is called temporal SMAS by the author, on which this dissection takes place. The release of ligaments, the suturing and the anchoring of the SMAS takes place under endoscopic control. For the proper reposition and anchoring of the SMS and of the malar fat pad is the complete mobilization and total release of any ligaments and incisions necessary. The SMAS will be anchored onto the zygomatic bone. Suspension sutures, Fadenschlingen in German, of the malar fat pad completes this lift. The scar is very fine if no tension exists. Therefore, the flap will be anchored onto the temporal SMAS after that a fine skin suture is applied. You see the young patient with mid-face psoas and tired looking before this procedure. The faces look, after decongestion, very natural without the operated look and without any stigmas. The only wound is a temple wound which heals easily and usually covered by the hairline. Because of the above-mentioned properties, advantages, and because of the endoscopic approach, we consider this procedure a new way in the incision-saving facial rejuvenation.
So, yes, we want to do one with the presentation. And we were, yeah. So I don't know how to proceed. We'll figure it out here. Well, thank you. We have done. So, it seems to be easy, but it's not easy. There are some risks, and it's another procedure as an open procedure, and an open facelift. There are risks. For example, we haven't any clear overview about the structures, as like when open facelift. The dissection of the SMAS and the suture are challenging in a tunnel. You should prepare and work in a small tuner under control on endoscope. Further risk are the temporal scars, hair loss. The small scar after TEM is hidden in the hair-bearing skin. Enough thickness of the temporal flap is important to prevent damaging of the hair roots. You see the unconspicuous scars, it heals very good. We have in a few months only a very small white line which is covered by the hairlines, by the hairs. You see the results here with some jowling and nasolabial fold, flatness, and lower lid contours, which are improved without any facial scars. Here's the immediate result after the operation without any great swelling, and after 3 months visible rejuvenation. Here is a woman. You see the pre-operative pictures with the brows, with sunken brows, with lower eyelid problems, with the jaws, and you see without any eyelid surgery the woman had an open eyes, a very fresh look, fullness of the mid-face and no jowling. You see? No facial scar. So, especially by this picture, you see the lower lid problem. We have made only a facelift by endoscopic way. She don't need any lower lid operation. He has a fullness of the mid-face, a fresh look, and no jaws. A very natural smile after the procedure. So once again, the problems, nasojugal falls, the skeletization under the eyes, the mid-face, the sunken mid-face, the flat mid-face, the nasolabial fold, and the very natural result after endoscopic facelift. Thank you.
Dr. Haffner, for your presentation from Omnix International. I give the certification of your works here.
Thank you.
Can you remain here?
Yes.